TDA Teleradio, straight out of Mercury.
The radio station you can't live without. This is your radio. Number one local station.
Them.
All right, good morning, everybody. It's 8:44, and it's a Thursday. It is the 6th of October. Remember last year? Oh, no. Yes, remember last year. Crazy, right? But it's sad news. Actually, funny enough. No, it's not even a funny story.
You don't know what to say.
She died from cancer like a week later.
Okay.
I didn't think we'll plan this, but it's actually that weird. It's a very beautiful woman. Very, very beautiful. Look where the looks come from. Right? From a beautiful mama. I got it from my mama. Oh my God, it's true. It's all right. Good morning, Salima. How you doing?
I'm good. How you doing?
I'm flavor, man. I'm fresh. I missed the Sunday.
Okay.
My birthday's on the 18th. It's 12 days away. And we got two beautiful ladies joining us on the show. It's EMP Drive on TD8. Hello, radio. Go to
TheDowAcademy.org.
Yes. Good morning, Doc. How are you?
Good morning.
Yeah.
I'm fine.
You're fine.
Yeah.
Welcome to the Dow Academy. And we also have Ame. How are you, Ame? Did I say your name right? All right, cool. Could you just help her put the microphone closer to her? Because I want to hear how she sounds. She sounds amazing. All right, cool. Like I said, it's the 6th of October, and it's a Thursday. It's EMP Driving. Today we're talking Cancer Month.
Yes.
Right? And yeah, so I mean, obviously, I'm gonna start with Ahmed. You're the one who brought up this whole idea for us to run this campaign every Wednesday or Thursday, and you're gonna bring special guests like you just did today. First thing is first. Tell us about Ahmed. Where is Ahmed from?
I'm from the Leo Club, which is the youth division under the Lions Club International.
All right.
Yes, so I'm actually a UB Leo, but there are different Leos. I think I know 4 clubs in the region. I'm not sure about how many there are in total.
Oh, great.
So yeah.
So UBLEO meaning University of Botswana,
Yes.
right? I don't want to think anything else.
No.
UV Ray, UV Ray,
Nah.
UB not. UB40.
UB40.
Yes.
Turning 40 this year, right?
Well,
UB, right?
plus
No?
2.
+2.
Yes.
Ah, okay.
I don't look it though, do I? I don't look for it. Oh my God. All right, cool. So UBLEO, and how long have you been part of the organization?
For the past 2 years, I started off as a Pakalani Leo.
Okay.
Mhm.
Yes.
Oh, Pakalani as in the school.
No, as
Yes.
in the club, the Pakalani Omega Leos.
Oh,
because
okay.
at the time I was going to a different school.
All right, perfect. And introduce your special guest that you bring today.
This is the lovely Dr. Raphaka. She
Yes.
is here to talk to us about childhood cancer.
Oh,
Ooh,
perfect.
perfect.
Childhood cancer.
Childhood cancer.
You can call it pediatric cancer. I think that's the
Thank you.
medical term.
Yeah,
Yes.
because childhood, I was thinking like, hey, my childhood was a cancer.
No.
I was just like, yeah, the cancerous childhood, Slim.
Oh, yeah?
Yeah.
Like the traumas and stuff. Okay.
Exactly. I know. That's what I was thinking. Good morning, Doc. Thank you for coming. We appreciate you.
Thank you so much.
Before I make any assumptions, are you a pediatric doctor as well?
No, I'm actually a GP.
All right.
Yes, I work at Pilane Private Clinic, which is newly opened this year, and it's at Pilane Crossing Mall.
Wait.
Hold on.
Are you the weatherman's mother?
Oh yeah.
Yeah. Oh, okay.
You want to ring a bell, man? Wait for kids,
Oh yeah.
Yes.
This is Aruna and Arata's mom.
Yeah.
Okay,
Bro.
okay.
When you bring special people, it's nice.
Becomes more special.
Exactly, more
Yeah.
special. Yes. I'm Ron.
Corona man.
Run the
man.
All right, joining us on the show is the lovely Miss Toy. She's on the controls, and we're talking all things pediatric cancer.
Yeah.
First thing is first. What is it? What is pediatric cancer?
All right. Let me begin by thanking Miss Amy Modipane for inviting me to come here, and also thank the Dow Academy for giving us an opportunity to come and talk to the public about childhood malignancies. It's an honor to be here. When you talk about childhood malignancy, or malignancy is cancer, the other name for cancer, but childhood, you mean pediatric, like little kids, like kids with cancer. So this particular time, I'm going to specifically, because cancers, there's just so many.
Yeah.
And you can imagine cancer does not exclude any part of the body. It can affect from head to toe. So there are just vast majority of them. But particularly this time, I'm going to talk specifically about a certain type of cancer for children. It's called leukemia. And it's a very common cancer with the kids. That's why I specifically wanted to talk about it. Yes, it's a very common one amongst them.
Okay, before you carry on, I know you're going to carry on. This is what I'm going to make this as interactive as possible. All right. So, do you know how to spell leukemia?
I could try.
Leukemia.
L-E-U. Right? I started there. L-E-U. Yeah, it's like
leukemia. I mean,
K-E-M-I-A, I guess.
It's a learning opportunity.
Yeah.
Please spell it out for us so people at home can know how it's spelled as well.
Yes, spelling depends on which spelling you want. There's European and American spelling.
Oh, that is true.
Yeah.
That is very true.
Yeah.
Yes, but
and these I did the Botswana in one. You understand?
Yeah. So I'll do the British one. It's Leukaemia. Leukemia. But with the American one, for K-A-E, you skip the A.
Yeah, they just do the chemia, like K-E-M-I-A.
Yeah.
All right. So the A is in.
It pronounced the same way.
Same cancer.
Yeah.
Different pronunciations, I guess.
All right. So you can carry on and give us, the causes or how to deal with it.
I'm going to talk about the leukemia.
Yeah.
And I would like to say for childhood malignancy, September is not that far away, but September is the Childhood Cancer Awareness Month.
Oh, we
Yes, but it's it's a few days ago, so it wouldn't be. It still fits to talk about it because it's the burden of the illness throughout the world. It's so high. Maybe I could say why talk about cancer in general. We know that cancer is the second leading cause of death worldwide. So, and yearly, we lose about 9.6 million people all over the world yearly. And the numbers are rising because 9.6 was 2018, then 2020 it was 10 million, and you can see that the numbers are rising. And that's why it's very important to talk about this illness and so that the people and the public is aware of them.
Can I ask a question? Yeah. This is actually something that just popped in my head. Are there any specific causes of cancer? And is there any way of preventing cancer?
I would say with cancer, there are risk factors. With the risk factors, there are some which you can't do anything about, and there are some which as an individual or as people we can do something about. Let me just give an example. You can have age as a risk factor for a certain cancer, but we know that age, there's nothing we can do with age. You grow. Yes, you can't say I'll remain 20 so that I don't get to 60. Yes,
not happening.
Age is a risk factor for cancers. And for another example would be gender. For example, you don't, if you are a male, female, you are female. But for example, breast cancer, the risk factor is being a female. We have more people with breast cancer who are female more than male. And we know if you are a female, you are more likely to get uterine cancer because men don't have uterine as much as prostate is with men, not women. So those are the risk factors that you cannot do anything about. Even the genetics, nobody chooses who they are going to be born from. Yes. So you don't determine your parents. That's something that you can do anything about. But when you talk about lifestyle we can do a lot about. So some cancers, like for example lung cancer, one of the risk factors is smoking.
Yes.
And smoking, you can do something about it.
You can do something about it. Yeah.
And the sedentary lifestyle that we mostly are having, you can exercise, be active, and and limit your risk factors for some of it. So there are some who can do something about, and some you don't.
So what causes leukemia?
All right. Let me maybe talk about cancer in general, like the normal, what happens in a normal body. So normally the body has a mechanism of taking things into control, controlling the body systems. So for example, if you have the red blood cells, they take around 120 days to wear off. Like if you have a red blood cells today, in 3 months it will be the body will just dissipate it, so that new ones come in. So that is a control body mechanism. So you can have, if you have those, for example, if you have 1 million cells in, the expectation is 1 million cells out and almost 1 million cells, new cells in.
Exactly.
Yes, but with cancer, the problem is that coordination is lost. That coordination that, okay, I'm making 1,000 cells because I lost 1,000. Now in cancer, you have a situation whereby you've lost 1,000. Instead of making 1,000, you make billions. And then the body just goes into chaos. Yes, so that's really what cancer really is. It's abnormal cells replicating in an uncontrolled manner. And then the body just loses focus. So even with leukemia, still the same thing, but the different cancers originate from different organs. So with leukemia, we talk about blood cells. It comes from, but blood is made in the bone marrow. That's where leukemia starts. So we have the cells in the bone marrow that makes that replicate or to make in a normal fashion.
Yes.
And then we have a situation whereby we are making white blood cells in the bone marrow, and then the body loses track, and then it makes more than enough. It just replicates without even stopping. So those cells get so many in the bone marrow that some even goes to the body. It will just go throughout the body, because that's how you make blood cells and then go through the body. So with leukemia, we have these white blood cells that are replicating in an uncontrolled manner. So that's what leukemia is in the bone marrow.
So too much of something is not good for you.
Too much of something is never good for anything in this world. Too much of anything is never good. And you can imagine when the body cannot even say stop.
Slim, any questions besides toy being so too much to us? As beautiful as
this is really interesting. I love the way she put it. Like, it paints a picture of
exactly
what happens. Like, you can imagine the bone marrow and the body just saying, good. Our kids will understand. I didn't understand before this.
This is like so we need education.
Yeah.
That we really need to. Yeah. Because I think when we watch this stuff on TV, you hear leukemia and this.
And you just see people with the symptoms and you just don't understand how it works.
Yeah. So it is a cancer of blood cells.
Yeah.
Let's put it that way.
Yes.
And sometimes it's called the bone cancer. Is that the same? Or it's all different? It's just the blood. Different. Because the blood cells start off in the bone marrow, so it's referred to that.
So with the bone cancer, the bone cells replicate in a manner that is not controlled. So that is bone. and with the leukemia is the
Blood.
cells, yes.
So what happens with Nyama? Like black people, let's just say they don't take their kids for these things to test for these things, whether it's dyslexia or these things. They just think this child is just being problematic. Hey, this child is not eating.
She's allergic to this.
She's allergic to
Doesn't
this
want to
and
do
stuff like
this.
that. How do we inform or educate people to come forward? And first of all, how do we get to know that, hey, my child is not looking well? What are the symptoms for us to pick up? Or what should we look? Because now I'm thinking as a parent, like I'm now thinking like when I look at my son, what could be
Wrong per se
wrong,
is
or what can I
leukemia.
look at? What do you suggest as a doctor, to parents out there?
Okay, I wouldn't talk about that, Africa, maybe we have this is a global problem. And I think it's not like in Africa we lack information only. The whole world does, as much as malignancies or cancers are concerned. So we need every country, everywhere in the world, we need public awareness every time, because you can imagine there's a lack of information throughout. So it's education every time, anywhere. Just like today, we say September was the month of the cancer awareness.
Yeah, right.
But it's
Nobody was just
September now,
like,
and we're still going on and on, because
Yeah.
there's never a time when we can relax and say now the public knows. No,
Yeah.
it's through public awareness that we can maybe go somewhere.
All right.
Now I'm going to talk about the symptoms.
All right. If we can talk about the symptoms after news, is it okay if we get through to the news or we carry on? Okay, we're gonna, since it's a special broadcast, this is actually quite interesting. I'm saddened by the fact that we didn't know that it was Child Cancer Awareness month of September.
Yeah.
I mean, all we think about is Women's Month and spring and
month,
everything.
next month is November.
Exactly.
Whatever. But okay.
Yeah, but it's
No, we'll do right. We'll do right.
We'll do right.
We learn.
Okay, no, it's fine.
And then let's talk the symptoms. You're about to get into the symptoms.
Yes, I'm going to talk about the symptoms for leukemia. Let me just say, leukemia is not only a cancer for kids. Even adults can have leukemia. The reason why I'm just specifically talking about children.
Yeah.
We're talking about children cancer awareness. So with the symptoms, I'm going to say symptoms for many diseases, they share symptoms. It doesn't mean that if you have this, it equates to that. So let me just make that clear in the beginning. But with leukemias, there are common symptoms that we should be aware of. We have frequent infections. Remember, the bone marrow makes those blood cells that, like white blood cells that protect us from diseases. Now you have these cells that are not functioning well, and then somebody gets prone to infections because now the body doesn't know how to get rid of those infections because of the leukemia. So there will be frequent infections, weight loss, easy bruising or bleeding. This is because the platelets that are made in the bone marrow, because the white blood cells are just so many, they're taking over the space, even the platelet cannot be made. So we have low platelets. If you have little platelets, you are prone to bleeding. So they'll be having some bleeding, even nasal bleeding all the time, and then or easy bruising on the skin. You'll see some bruises and say, but I didn't even bump onto anything. What is really causing my child to have this? She's never had an injury or anything of that sort. We have excessive sweating at night, persistent fatigue, and weakness.
Stop looking at me when she said sweating.
Like I said, there's so many different things, different symptoms. Yeah, fatigue. You can also have swollen lymph nodes, especially on the neck and the armpits. And bone pain. Remember, they are in the bone marrow, inside the bone. Bone marrow is inside the bone. So you can have bone pain due to that because there's just too much going on inside. Some do get this really tiny red spots on the skin. We call them petechiae. So yeah, those are the symptoms that you have to look out for.
And
Does petechiae have its own name?
yes, that's a
Sorry?
good question actually.
Does the petechiae have its own name?
No,
'Cause that's how we would identify it.
Yeah, some of these things, some of the medical terms, they don't have a specific word in Setswana, but you can only describe. In Setswana, if you want to translate, you are going to have to describe what it is. But with petechiae, the spots in the khibidu mo mmeleng, mo letalong.
Has mo go bidiwang madi a ke re go le mo go
No,
okay.
no, has madi.
Ehe.
Has more with
Yes,
madi.
blood cancer. Yeah.
Well, thank you, doctor, for that. It's 5 minutes past 9. Like I said, this is the ENP Drive on TDA Turtle Radio. It's the 6th of October. Ame. Yes, you just don't have to. Oh, who's this? Somebody's just dropping a message?
Yeah.
Oh, okay. Good.
Wuban.
Who's this person?
He's like, hello, I last saw Ami at Believers just in the college. From one, it's the same Ami.
Yeah, I remember him.
Hey, Doctor. All right.
Oh, is that Doctor?
Yeah.
That's good.
Okay.
Hey, he's also got a sister as a doctor, isn't it?
Yes.
Yeah.
Yeah, so he's got interest in doctors.
Okay.
Do you want to be a doctor?
I used to want to be, but I changed paths. So.
Oh. So what is it that you're studying?
Network systems engineering.
Oh, okay, that's the same as just knowing body parts and how they work together.
Yeah, like network.
Yeah,
how does the head to the
exactly? You know, got the heart, there's good
Network,
veins,
like-
which are networks.
No, this is like computing.
Wow,
yeah,
you actually had to
so
correct that. That's pretty
I'm
good.
so sorry.
I know it's okay. It's interesting. So what year are you in?
I'm in year 1.
Year 1. Okay, that's good. So all right. So why this project specifically? Because we've never had any of the other Leo members come out to us.
I think the Leo Club has been all of the Leo clubs have been a little quiet since COVID. There hasn't been a lot of activity, but we're getting up and running.
Okay.
So last month was Childhood Cancer Awareness, and I figured it's a good opportunity because personally, my grandmother's fighting cancer right now, so it was sort of inspiration. And honestly, who better to teach than the kids about cancer and specifically concerning them and the parents? I think we've done enough dealing with COVID. That's been scary enough, but now there's something else we need to deal with. So, yeah.
Thank you, man. Thank you so much for bringing Doctor to the show, to the Dow Academy. It's also beautiful that you're also a parent at the Dow Academy. So you're part of the community. And people can find you where? Where can people find you?
I am at the clinic.
At Pilane Crossing?
Pilane Crossing Mall.
Okay.
The Pilane Private Medical Clinic.
Great. You're the only...
the only GP there.
Yes, great. Because we don't want them to go to the other one.
That is very true.
That is very exactly. Yes.
So we're also on Facebook.
Mm-hmm.
Yes. And you can call us on the landline.
Okay, so on Facebook and Instagram and Twitter, what do they say? At what?
Pilane Private Clinic?
Yeah.
Oh, wow, there you go.
You know what I'm saying?
Easy as that.
Yeah, you're sick like
So
that.
we're on
PPC, mate.
on Facebook. Not yet on Twitter.
Is it? You've cemented it very well. So we can be very clever here at the Dow Academy. After all, we're growing problem solvers. Yeah. All right, cool. Thank you guys for coming through. We're gonna let you go because you got a lot of sick people waiting, hopefully. right? Yeah, I mean that's the business.
That's the business. There's nothing we can do about it.
People must get sick so Doc can make some money. And also, I mean, before you go, who's coming next week? Do you have someone already lined up, or it's gonna be another special case?
I think we'd like to keep it as a surprise. Maybe you might get the lovely doctor again.
We got no problem with that.
We got no
The
problem.
problem is he's got 2 kids here, so he come twice.
You're amazing. You do radio very well, which is great.
Yeah, especially when it's like this. Like she's good to listen to.
Yeah. You paint things very simple.
Vivid.
Very, very vivid. All right, cool. Before you go, let's ask Miss Toy. Do you have any questions? Do you have anything you would like to ask? Yeah. What I wanted to know before you go is the age group that we're talking about when you say children, because some of them like Tuo and Carl, they're still children to us. What age group are we talking about?
Yeah, for leukemia, children we mean everyone from 0 to teens.
Yeah.
Yes.
So
Maybe 16.
Yeah,
16,
15, 16. Yeah, there.
Okay.
Yeah. But what I wanted to say is, it's not like gloom with leukemia. The good thing about childhood leukemia or pediatric leukemia.
Okay.
Yeah, treatment is there.
For that specific one.
Yeah,
for like
that
childhood.
specific one. Yeah. And the outcome and the prognosis is so good. Like the 5-year survival rate is 90 to 94%, which is like, wow, it's not in vain.
Okay.
Yeah.
Now you know.
So better now than later, right?
Yeah.
Of course.
True.
Otherwise, you just become late. Thank you very much. It's 10 minutes past 9. It's been a beautiful Thursday morning. We'll be carrying on with the show till we get to host Boatwood around the Dow Academy. You can find us on
thedowacademy.org
or on all our social media pages, which are
Facebook, Twitter, Instagram, and LinkedIn.
Yes. So, Ahmed, please do tell your friends and you be buddies.
They definitely will know.
Yeah.
Actually, I think if it's possible, we could maybe have a link so that we could put it on our pages.
Definitely.
Yeah.
We're going to search you out with the link, or even just for the sake of this specific segment, we'll cut it out for you so that you can post it wherever, even on your Facebook page and stuff, so you can circulate. Yeah?
That would be lovely.
All right, thank you guys. You can find us here in Mochudi if you're driving from CBD or what they call Gabs or Planet Crossing. Yeah, get to Cabo Mall. It'll be on your right. Turn left. Cross over the four-way stop. Please don't get to B6 or Dirang. Yet. And then come straight across the four-way stop. You'll find the Dow Academy Primary is on your left. And if you want to know where the reception campus is, it's directly across the road from the primary campus. My name is EMP, and with Uncle Slim and the beautiful Biz Toy. It's been a beautiful Thursday morning with Doc. I don't want to say the name wrong. Guys, sometimes, some of us went to colonial schools. It's going to sound like Dr.
Raphaka.
Raphaka.
You know what I'm saying? Hey, man. These guys were laughing at me yesterday for not saying debater right. Yeah, you know where debater is.
Debate.
Oh, okay.
Yeah, you know what I'm saying? Debater.
In the game. Turn this up. Everything is A-OK. This is hot. Positive hits in hip-hop. Hip-hop. Turn this up. Let the music lift your soul and sharpen all your senses. Life is hard, but God is good. Is good. Proudly headquartered and streaming globally. Turn this up. Everything is
You are now listening to Chill Game Music. Please like and subscribe.